Welcome everyone, this is Dr. Clark from the Center for Weight Loss Success. Tonight on Losing Weight USA, I'm going to continue a discussion we started last week. I actually covered some of this last week and there'll be some redundancy, I imagine. But it is an important topic. It's a topic that's of concern literally to certainly every woman, as eventually this happens to every woman. Last week we talked a lot more with the testosterone and some of the hormonal changes as well, which affect both men and women. Tonight we're talking more kind of at the woman side of this thing, the estrogen dominance, estrogen deficiency. All right, welcome to Losing Weight USA. This is your kind of answers to your weight loss questions with a little bit of the latest updates and research, a little bit of expert advice. Gives you not only access to me, but you should be receiving the health tips and recipes via the membership portal. Each webinar is going to last about 30 minutes or so. If you have questions, just type them in during the presentation. If you think things once we're all done, just give us a yell here at the Center for Weight Loss Success. The email is success@cfws.com. Phone number 757-873-1880. All right, we're going to flip these slides. There we go. So hormones, I just like this slide, so I threw it on there. We're talking about hormones. All right, so estrogen, and with every hormone, is balance is key. So I say this every time we're talking about any type of the hormone, whether it be thyroid, testosterone, pituitary gland growth hormone, whatever we're talking about, balance is key. Too much is bad, too little is bad. Okay, so and this is true with estrogen as well. And unfortunately, estrogen tends to become imbalanced over time and can cause significant symptoms. All right, so once again, quick review on what are hormones. Hormones are just chemical messengers. That's all they are. They're made by one tissue and subsequently they're released into your bloodstream and subsequently they travel through the bloodstream then if this other tissue has a receptor to that hormone, it receives a message. So it's very key. You not only have the hormone, but you have to actually have the receptors too. So the receptors are going to be throughout different tissues. The hormones specifically generally made by a certain, any one tissue. Some tissues make multiple hormones. The pituitary gland makes multiple different hormones. The ovaries actually make multiple hormones, estrogen, progesterone, and testosterone. So there are multiple hormones made, but they're generally made by a limited amount of tissue. But they can have effects throughout the whole body, not just those right around that organ or anything like that. No, they travel through the bloodstream, and any tissue that has receptors on them will receive the hormone, and the hormone then basically is sending a message. And then the cells, whatever that tissue is going to, the cells in that tissue will do something. Okay? So only the tissues that have the receptors can actually respond. It's kind of that lock and key concepts. And hormones are one of the main tools your body uses to maintain homeostasis, which is just balance, kind of overall life balance, if you want to call it that. So again, hormone balance is a key concept with all of this. So we're talking about here sex hormones. Specifically, we're talking more to the women tonight, but all the sex hormones, again, are derived from cholesterol. So it's not like, hey, it's a good idea to get rid of cholesterol. So no, that'd be a really bad idea because most of our digestive juices are based on cholesterol. A lot of different hormones, a lot of different components in our body are actually derived from cholesterol. So cholesterol is a very important molecule. We kind of, throw stones at it all the time. They're like, ooh, bad cholesterol. But cholesterol is something we would die without. And we need this. And so all the sex hormones are derived from the cholesterol. That's testosterone, progesterone, and estrogen. And humans make three types of estrogen. Estrone, called E1, estradiol, di means 2, so that's E2, and estriol, tri means 3, so that's E3. So E1, E2, E3. And it's estradiol that's the most important one. Estrones kind of comes into play once you go through menopause. Okay? Estriol is very important during pregnancy. But estradiol's that one's kind of the main driver throughout most of life there, okay, for women. Now, men and women share these hormones, so it's not like men don't have any. It's like, no, they just have much lower levels, and then it doesn't affect them as much. But for men, men need estrogen. Okay? They just don't need very much. So again, that's balance there again. But you certainly don't want zero estrogen. For men, you don't want zero estrogen. But you also don't want real high estrogen either. There are problems that develop with either of those. So the only difference between men and women in these hormones are just the absolute relative amounts of them. Okay? Women will have much higher amounts of the estrogens, men much higher amounts of the testosterone. All right, so again, we're talking mainly about estrogen tonight. So it is the primary female hormone. It's the ovaries that make estrogen, but also the adrenal glands. The adrenal glands can produce some estrogen too. So even if you've had your ovaries removed, or if you've completely through menopause, which menopause basically means the ovaries quit working. Okay? So that doesn't mean the estrogen levels go to zero, because the adrenal glands can make a little bit of estrogen, estradiol, and also some of the fatty tissue can actually make a little bit of estrogen. But estrogen is a very important hormone. It has at least 400 different functions and many, many different tissues. And estrogen receptors are widely distributed throughout the body. If you think about it, they're widely distributed throughout the body. The estrogen is important for something. Okay? The receptors wouldn't be in the tissue if they weren't important to that tissue. So widely distributed, the brain, the breast, the bone, blood vessels, reproductive organs. So it should be no surprise that when you have fluctuations in these hormones, it could cause symptoms in any of these organs or systems, if you want to call it that, from your brain to the breast tissue to bones, blood vessels, and obviously reproductive organs. Okay? So estrogen obviously is very important for sexual maturation. It's kind of once the ovaries start working as you go through puberty, that's what then makes you kind of sexually mature. Okay? And with that, it typically then causes some of those maturation changes from breast development, widening of the hips, and women having cycles. Okay. So again, adult women produce 3 primary estrogens. Estradiol is the most important one. Estrone, that's E1, also important, but probably because we'd like less of it as we get older. We'll talk about it here in a couple minutes. And estriol is very important in pregnancy. We're basically not going to touch on that much at all tonight. So, mentioned kind of right at the beginning, estrogen dominance versus deficiency. So estrogen dominance is kind of referring to there being more estrogen in comparison to the other hormones, and specifically we're talking about progesterone, versus estrogen deficiency, which is basically what menopause is, when the ovaries quit working and estrogen levels go really low. Estrogen dominance may not be that the estrogen hormone itself is way too high. It just means in relation to some of the other hormones, specifically progesterone, that may be dominant to it. It means it's actually a little higher than what you'd want it to be, which can lead to imbalance. Okay? So hormone production typically peaks around age 25. And then until menopause, the estrogen production remains fairly stable. So it's not like all of a sudden when you start getting symptoms, it doesn't always mean that the estrogen levels are going way, way out. It may be that some of the progesterone levels have just dropped off. And so again, that's an imbalance then, which we often then blame maybe on estrogen, but it may not actually be that. Now progesterone, so since I mentioned that estrogen levels, estradiol specifically tends to stay pretty level. Okay, the levels throughout, changes day to day during a cycle, but from year to year to year to year, pretty stable from mid-20s to menopause. Yeah, so we're talking a good, 25 years or so there. So at menopause, then estrogen levels go way down. Now, progesterone, on the other hand, though, drops much more quickly. So as estrogen levels stay pretty stable, progesterone tends to drop more steadily. And from kind of the age 25 until menopause, it slowly keeps going down and down and down. And so now you've got this estrogen that's staying fairly normal, I'm going to call it that, but progesterone levels that are dropping, this can then lead to estrogen dominance, which can subsequently then cause symptoms. Okay? And just in a graphic form, it just kind of this showing two lines here, and just that progesterone, which is the lighter color line, drops much sooner in age, kind of that literally from 25 on out, slowly coming down, whereas the estrogen is staying more stable and subsequently doesn't really drop till you get closer to menopausal age. So when we say estrogen dominance, kind of that's what we're referring to. It's not that you're making way too much estrogen. It's that in relation to the other hormones. Okay. So isn't this just aging? Isn't that what aging is? Yeah, okay, hormones change a little bit. Yeah, but again, poor balance makes a number of medical problems worse. So this estrogen dominance can also disturb other things. It can disturb thyroid function, and it can increase thyroid binding proteins, which means it's binding the thyroid hormone, which then subsequently slows your metabolism. It can worsen insulin resistance, which can lead to weight gain. We talk about that pretty much, insulin, the hormone we talk about every week. Okay? And it can also then, by progesterone kind of dropping, it also increases E1. E1 again is estrone. Estrone now says, okay, the estradiol is staying pretty stable throughout there, but if estrone levels go up, this is then again making that even more divisive in that there's higher estrogens total, lower progesterones. And it tends to also be worsened by some of the things we're exposed to, whether it be hormones that are fed to animals. They're kind of the hormone, you may find this in certain eggs, you may find this in plastics, some of the plastic components, the phthalates, xenoestrogens that we are exposed to can also lead to worsening symptoms. And again, poor balance tends to lead to symptoms. Okay. So what are those symptoms then of estrogen dominance? And they're very common symptoms. So one of the problems you can say here is that some of these symptoms are relatively vague. In that it's like, is it really estrogen dominance or is it just changes that are occurring? But here's some common things that occur: mood swings, anxiety, weepiness, irritability, depression. I can get panicked. A lot of these things are very common. Insomnia, joint pain, bloating, heavy cycles, fibroids. Progesterone levels low, fibroids more prominent, fibrocystic breast tissue, lack of sex drive, difficulty concentrating, worse cravings, headaches, weight gain, water retention. All these things really common. So how do we do it? Well, unfortunately, there isn't a whole lot we do. Sometimes adding a little bit of progesterone can be helpful. Now, the potential problem there is one of the most common side effects of progesterone. And bioidentical, if you're going to use any, we're not talking about progestins, which a few weeks ago, I think we talked about bioidentical hormones. We're talking about true bioidentical progesterone. Okay? But progesterone actually is a very safe hormone. You could actually take massive doses. It's a very safe hormone. But common side effect of progesterone is weight gain. And that's part of the reason why progesterone, and we talked about this last week, so as for women, okay, they tend to gain weight more in the hips, buttock area, as opposed to men in the belly area. Okay? Women, it's more in the buttock area, and that's progesterone. Progesterone tends to cause you to gain more weight in that area. Okay? Diet can be very helpful because there are certain vegetables that tend to have components of them that actually make you have much healthier estrogen breakdown, estrogen metabolism. Okay, so diet can be very helpful. Broccoli, cauliflower, cabbage, kale, another one, Brussels sprouts, very high in a component called DIM, diindolylmethane. Diindolylmethane and this indole-3 carbinol, which is often as I3C, but indole-3 carbinol and this diindolylmethane, DIM, much more common, actually helps metabolize healthy metabolism of estrogen. Okay, it can actually be taken in supplement form, so it's not like, well, I have to eat a mountain. It's okay to eat a mountain of broccoli, cabbage, cauliflower, because no one gained I never should say never. Okay, almost no one gains weight from I'm eating too much broccoli. Okay, but it can actually be taken in a supplement form. Okay, we've got it here in our nutritional store, but you can find it out there, and it does make a more healthy metabolism of estrogen. Okay? And kind of, you don't want estrogen levels way out of whack, and that's going to cause more problem from uterine problems, breast problems, those type of things. Okay, now the other end of the spectrum, not the estrogen dominance, is estrogen deficiency, and that's basically what menopause is. Menopause is the ovaries quit working. Now, whether it be a surgical menopause, meaning the ovaries were removed, or actually just physically going through menopause. Average age of menopause is around 50 to 51. Okay, but you can get symptoms, or it can be a problem literally 10 years before, 10 years after. Right? Okay, so it's not like it happens overnight. Usually something that occurs over a period of time. But the average age of true menopause is about between 50 and 51. Estrogen, often used to help some of those estrogen deficiency syndromes. Okay, and the biggest symptoms of low estrogen are night sweats, hot flashes, but also vaginal dryness, painful intercourse, depression, those type of things. A little more vague there, but those things can be very important, though, to treat. If it's going to be treated, the best treatment is actually using bioidentical treatment, bioidentical hormones, which means the hormone looks exactly the way your body made it. Okay, and bioidentical hormones then subsequently tend to have more of a protective effect, as well as not only protective effect, but actually then treating the symptoms as well. Estriol, much less often used, only because it just doesn't, it's not as strong as estradiol, and so typically it doesn't work quite as well. But it is protective against certain problems. Breast cancer is one of them. It also then can control menopausal symptoms. Okay, there are really no negative properties of that. Kind of typically when the people talked about hormone replacement and all the bad things that happen, when they talk about heart problems, blood clotting problems, what they were talking about is, one, synthetic hormones, and also mainly synthetic progesterone, which progestins. Okay, those are the big culprit in there, and also because hormones, especially estrogen, does not work well as a pill. We have to give you great big doses. Plus, if it's not bioidentical, it tends to cause more problems too. You know, think about it. If you have to have great big doses of anything, the only difference between a medication and a poison is a dose. Tylenol works great for a headache. A bottle of Tylenol will kill you. Well, that's dosing right there. So too much of anything is never a good thing. All right, so there really aren't a whole lot of negative properties there. So in summary, kind of estrogen dominance, estrogen deficiency are going to be something that affects all women. I mean, it's not like it's not going to happen. It's like, well, it is going to happen. It's just when. Okay? Some women get a lot of symptoms of estrogen dominance. Many women do not. Many women get almost no symptoms of estrogen deficiency. Many women do, though, and it can be torturous for them. And it's not all in your head. And it's also not just natural aging. Yes, it goes along with aging, but that doesn't mean that it shouldn't be treated. Yeah, if it is to be treated, definitely recommend using a bioidentical hormone replacement as can be the answer there, not just kind of effectively treating, but actually can prevent some certain problems too. All right, it is what we do at Center for Hormone Health and Wellness. If you have questions about that, we got all kinds of information about that. We'll talk further about it. I don't see any questions sitting out there at the moment, but obviously if you think of something, don't hesitate to pick up the phone or walk in the door or send an email. Okay? You should be stopping by, getting your body composition done. We encourage that. You want to make sure you're losing fatty tissue, not losing a lean body mass. You should be receiving the health tips and weekly recipes. Tune in each Tuesday, 6 o'clock for the next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good evening, everyone. Take care.